So have you heard about this popular new pastime? It's called pickleball. It's a cross between badminton, tennis, and ping pong. But reports show many people are injuring themselves playing this. So what's all of this about? With more on this is Oxford Health Doctor Karim Meijer, a sports medicine orthopedic surgeon. He's also the head team physician for the New Orleans Saints to answer some of these questions and give you some tips today. So thanks so much for coming in. I appreciate you explaining this. It's obviously become a popular thing. First thing, for people who are not familiar, and a lot of people aren't, like what's the difference between badminton, ping pong, and pickleball?
I think pickleball is kind of a hybrid of all three. So it kind of brings all three sports together, and it's something that the entire family can play, from a 5-year-old to a 105-year-old. You can just pick up a racket, you can go out, and you can play.
Yeah, and it's really taken off very quickly. So, you got this Bloomberg report. It's basically saying that pickleball injuries could cost Americans up to $400 million this year to deal with these injuries. What do you think so far, based on what you're seeing, is happening when people are playing that's leading to these injuries?
So yes, I have myself treated patients with this already, operated on a lady last week for this pickleball injury. And I think what we see is that since it's an easy sport for anybody to play, you have someone who may just say, well, I want to get up and get active, may not have been maybe ready to be active. If you see people who play pickleball, it tends to be 50, 60, 70-year-olds who are now picking up the sport. So when you bring someone maybe sedentary off the couch playing a sport, the sprains, the strains, their movement isn't maybe the best, or they're mentally 25, physically 65, so some things happen. My wife gave me the best advice. She said, sometimes you just need to say good shot and don't go after it.
That's probably some good advice.
Yeah.
So what would you say to people who are saying, I want to get in, I want to do this, but at the same time, I don't want to get injured? What are your safety tips? Where do you start from the moment you get up and you get to that court? Yeah,
I think the basics are easy. So like the Saints, they always start with a dynamic warm-up. So get out there, whether jog, get on a stationary bike, an elliptical, warm up the body first, do a light stretch, some basic stretches in pickleball, because it's a lot of hand and wrist, can just be some flexing wrist and elbow, warming those things up. Then when you play at somebody that's your level. So you don't have to worry about trying to chase a ball or putting yourself in a bad position. Find someone that's an equal level with you, start with there, and then just take it easy. If you haven't really been doing stuff for a long time, start maybe for first 30 minutes, take a day off, get back out and slowly pick it up.
Okay, and it's great that people are out and they're exercising. Doctors like yourself encourage that. What are some of the injuries, though, that you risk getting? What have you been seeing, the types of injuries people are getting with this?
I've seen everything. I've seen the sprains, the strains, so the ankle sprains. I've treated meniscal injuries with this. You'll see calf strains with this. Some low back stuff I've seen. Not as much in the hand and wrist elbow things that we see in tennis players, because it's more light, but they can still get it. And even just tripping, stumbling, falling. And you can get a wrist fracture, you stumble backwards. Those are the things. Those are the things that we've seen.
And as someone who works with the Saints team, I mean, they do the basic warm-up, so you should take a page out of their book, right?
Yes.
Warm-up is really important in stretching.
Unfortunately, we are no different than the Saints players. We all have to do the same things that we provide for them. We should be doing the same thing. And they're no different than us. They're just a lot bigger, faster, and stronger.
That's a good way to put it.
That's about it.
Okay, apply the same skills if you're going to do pickleball.
Yes.
Thank you so much. Appreciate
You're welcome.
it.
Thank you for having me.